Hi, my name is Leslie Tingey, and this is my presentation, Turning the Tide, a Public Health Perspective on Ischemic Heart Disease in Thailand. To give you a little bit of background, Thailand is a Southeast Asian country with about 71 million people. While Thailand is highly developed in some areas, it is lacking the infrastructure in rural areas to be considered a first world country. This middle-income nation has an emerging economy, but the rural-urban gap remains a constant challenge in healthcare services. Rapid urbanization and an aging population also make it difficult to create proper infrastructure to service all the areas. Ischemic heart disease has been a growing concern since the early 2000s, but most efforts in that early time were focused on acute care and treatment, while taxes levied on tobacco and alcohol during that time funded health care. In 2002, the 30-baht scheme was introduced. This was a universal health coverage program in which any citizen of Thailand could see a provider and get treatment for a co-payment equal to $1. In 2024, the 30-baht Treats All Disease program transitioned to the Treatment Anywhere program, and a digital health system was integrated to expand services, allowing almost 99.5% of the population to now have health protection coverage. Additionally, Thailand made a strategic shift to preventative treatment, introducing primary care and screening campaigns. These actions increase survival rates for ischemic heart disease. However, much of the population of Thailand is not accustomed to seeking health care for illness. Instead, they seek home remedies and many religious practices to address illness. The mortality rate for ischemic heart disease in Thailand is 65.5 per 100,000 people. Interestingly, the statistic for men is worse, with 72.7 per 100,000. Additionally, there was a 60% rise in men under 60 from 2012 to 2021. These rising rates of ischemic heart disease in men and in younger adults highlights the urgent need for targeted public health interventions. The epidemiologic triangle shows well-established host factors, including males under 60, those with hypertension, diabetes, hyperlipidemia, obesity, and family history. Atherosclerosis is the underlying cause of ischemic heart disease, but the processes of cholesterol deposition and endothelial dysfunction are the true causative agents in this triangle. The key social and environmental factors that participate in this triangle are unhealthy diets, smoking, processed foods, healthcare access, health illiteracy, reduced green spaces, and a shortage of healthcare workers. And these are all modifiable and systemic environmental contributors to ischemic heart disease. The World Health Organization has identified ischemic heart disease as the leading cause of mortality in Thailand, bringing substantial health and economic implications. Disability and premature deaths lead to significant losses in the labor force, participation, and productivity, which creates an economic burden on both individuals and the economy as a whole. The total economic cost of cardiovascular disease, which includes ischemic heart disease, is $1.3 billion. And 4 modifiable risk factors, hypertension, tobacco use, high cholesterol, and physical inactivity, account for about 77% of that total cost, $1 billion. So addressing the modifiable risk factors would potentially have a very large impact on the economy of Thailand and the quality of life for its people. So, how can the Thai people get the care they deserve? Well, sustainable change relies on culturally sensitive programs, scalable pilot projects, and robust public policy. Although Thailand introduced digital health technology, there needs to be an ongoing push to reach individuals in remote areas. While not everyone in Thailand in the rural areas has a computer or internet access through a computer, most everyone has a smartphone and access to telehealth that way. But we need innovation to include the development of mobile apps to track diet, exercise, and overall health, as well as health literacy campaigns that include social media and are tailored to respect local traditions and languages, while also encouraging a change in the accepted cultural norms related to diet, health, and wellness. Educating the population about healthcare and the positive outcomes that can happen with early intervention might persuade individuals to seek professional healthcare rather than relying solely on home remedies and religious practices. We also need to bolster community-led volunteer health education seminars and screening programs for diabetes, hypertension, and high cholesterol. The World Health Organization reports that 1 in 4 adults is affected by hypertension, yet less than 1/3 of all adults have their blood pressure under control. This is most likely an issue of the lack of knowledge of the benefits of early detection. People don't realize they are sick or ill or have a disease because hypertension is a silent killer. Community screening programs, which are successful, can then be scaled to larger programs. Policy support is a key element in altering a population's health behavior, and Thailand's healthcare evolution in recent years reflects a strategic shift from reactive treatment to proactive prevention. Recent policies have included food labeling, product reformulation, and research initiatives to encourage production of foods with reduced sodium content. Policies offering grants and low-interest loans for new schools and training for healthcare workers would be other options of policy support that could improve the shortage of healthcare workers and reduce the strain on the healthcare system. Also, expanding taxes on tobacco and alcohol and even sugary drinks, and possibly offering fiscal incentives for those who do not engage in these activities, could promote individuals in a positive attitude toward a healthy change. Thailand currently receives global support from organizations like the World Health Organization, Association of Southeast Asian Nations, and the Health Intervention and Technology Assessment Program. The Global Hearts Initiative of 2016 by the World Health Organization offered a collaboration for strengthening the management of cardiovascular disease through tobacco control, increasing physical activity, reducing salt consumption, and removing industrially produced trans fat from the food supply, as well as providing evidence-based prevention and bolstering primary care. Another organization is the Regional Health Collaboration of ASEAN, the Association of Southeast Asian Nations. Thailand benefits from shared expertise, technical support, and data collected through this collaborative framework. Its members meet together regularly to establish and manage regional health priorities. A non-governmental organization that is of great value to Thailand is HITAP, the Health Intervention and Technology Assessment Program. This organization conducts research and assesses technological interventions like telehealth and health texting services and surveys. Global support of organizations like these enhanced Thailand's ability to implement comprehensive prevention and treatment programs for ischemic heart disease. Thailand is making good strides to improve and turn the tide of healthcare and mitigate the modifiable risk factors of ischemic heart disease. I am eager to watch their progress develop in the next few years. Here are my references. Thanks for watching. I hope you are interested to observe with me as Thailand turns the tide on ischemic heart disease.